Hi, my name is Dr. Catherine Wilkinson and I'm a GP at Talacross. So most people with psoriasis would find it very annoying to have their condition. They find the daily treatment regime quite annoying. Also, if a new patch of psoriasis appears, they worry, is this patch going to spread? Are they going to experience another flare-up of their psoriasis? So with that can come anxieties as well. And then for certain people, it can culminate into depression for them. It can make them feel more self-conscious about their skin. They can feel embarrassed. It can lead to them avoiding social situations like just even going to the swimming pool, going on a date. They can avoid even applying for a job because of their psoriasis. As oftentimes they're worrying about, are people just going to stare at their rash? Are people going to mistakenly think that my psoriasis is contagious? I think most people, even including loved ones of patients with psoriasis, underestimate what that person is going through. I think that there are various reasons for this. I think people tend to suffer in silence. They tend not to open up to others about how they're feeling. They may feel embarrassed to discuss their feelings. They might find it difficult to describe how they're feeling, or they may not want to burden those close to them with these feelings or letting them know that they're feeling distressed. A GP is a specialist in holistically managing patients and treating their conditions. And certainly psoriasis is a condition that needs to be managed in this way. We are the first line clinicians in dealing with most medical and psychological issues for people. So we are well placed to not just discuss a person's rash with them, how can we improve it, also listen to how their psoriasis is distressing them and formulate a management plan that we can both agree on. In my experience, I think patients will open up to their GP about how they're feeling if they're specifically asked. Outside of this, they're unlikely to bring up the subject themselves. And if they do bring it up, it's usually at the end of a consultation. So what I would say to patients with psoriasis, if they are feeling distressed about their rash, to make their psoriasis the focus of the consultation and be open with their GP about feeling distressed at the very beginning so that it can be given the time that's needed to explore it fully. So there's many steps that a person with psoriasis can take in order to improve their mental health. I think a first step might be to look up the Irish Skin Foundation website. They've got an excellent document which will educate them about their psoriasis. And knowledge is empowerment. And with empowerment comes a sense of control, which is only a good thing for your mental health. Exercise, reducing alcohol intake, smoking cessation are all good things for your mental health and improving your psoriasis. The Irish Skin Foundation also have a helpline where patients with psoriasis can access the guidance of a highly qualified nurse. And through that helpline, they can also gain access to speak with somebody who also suffers from psoriasis. And a lot of patients get benefit from that support. In addition to these things, they may consider two different psychological approaches to managing their psoriasis. Mindfulness and cognitive behavioural therapy have both been shown to reduce someone's stress levels and also improve their psoriasis. So mindfulness resources and cognitive behavioural therapy resources can be accessed online. So a person can practice these themselves at home, or they may consider joining a mindfulness class or seek out a psychologist who specialises in cognitive behavioural therapy. And not every approach suits every person. So it's about trying to find out, well, which approach suits you. So to anyone out there who's distressed about their psoriasis, about how they're feeling mentally because of it, I would say don't lose hope. All these things can definitely be made better. Thankfully, there are many good treatments out there to manage your psoriasis, which can dramatically improve your quality of life. And if these things are bothering you, I would say make an appointment with your GP so you can discuss it more.